Is Helmy here today? Ahlan wa sahlan. Please come on up. All right. Helmy Eltoukhy is here. He is a founder and CEO of Guardant Health. Good to meet you. A specialist in both cancer detection and blood tests. I also hear that you're associated with a football team, soccer team in the UK. Is that correct?
Yeah, that's correct.
Okay. Would you be willing to share which team that is?
It's Sheffield United. I'm the co-chairman of that.
Would you still have lunch with me if I was a Tottenham Hotspur supporter?
No, all the guy who does analytics for us does it for Tottenham as well. So yeah.
I think we can be friends.
Yeah,
fantastic. I also have Ayah Hamdan here. Give it up to Ayah Hamdan, please. She's the Director of Health at Plug and Play Ventures. For those of you who don't know, Plug and Play Ventures is one of the largest platforms and actually, I would say, innovators in the startup investing ecosystem. 65 offices across the world and invests in hundreds of companies a year. With that, Ayah, take it away.
I think we're at over 200 companies a year.
Okay.
Hi, everybody. How are you doing? Great. Thank you for that energy. Well, I'm extremely excited to be here, not only because I'm a fan of Transform VC, Raed, of course, a close friend, now family and mentor, but because I get to chat with Helmy, the co-founder, CEO of Guardant Health. And so I've known the story of Guardant Health for a while now. Plug and Play was an early investor back in the seed stage. And so when I'm giving tours of the building at Plug and Play, we've got the Guardant Health logo as one of our unicorns. And so I've been telling the story for a while, but today I get the chance to ask you directly about your journey and how you got to where you are. So looking forward to it. And for those in the audience, you are very welcome to scan the QR code. I might be a little selfish and keep the questions for myself, but if we have time, I promise I'll get to some of the questions that come in through the code. So to kick us off, you are the co-founder CEO of Guardant Health. Prior to Guardant Health, you were already an entrepreneur. You founded a company called Vantum, which was later acquired by Illumina. And the question that I have for you is, you've had 2 successful exits under your belt. At what point in your journey were you building with the exit in mind? When you started Guardant, did you say, I'm going to go public in a few years? Or what was that? What was that point in your journey when you saw the exit in the near future?
Yeah, that's a great question. I don't think I've never been of the mindset where you're building a company for this sort of like end result that's a sort of either a financing or a financial outcome. It's really about the impact that you're building at the company. And, we are always, I think, there's so much blood, sweat, and tears that you sort of, you pour into any endeavor that you start. And, it's such a hard slog when you think about starting a company and all the ups and downs that you go through in terms of, fundraising, the technology, the twists and turns, something often doesn't work and you have to go back to the drawing board. And they just think like, oh, I'm just going to take it to here and flip it and make a quick buck like you're, renovating a house and flipping it and so on is not the mindset that I had. And so I would say, but you have to be a business person as well and like a realist in terms of, I think what Bill was saying, like, sometimes you figure out that the market that you're building for is maybe not as big as you thought it was initially. And so I think you have to be able to take inputs, take new data in, and continue to iterate and essentially, kind of take twists and turns in terms of the path that is ahead of you. And so I think the first company you started was out of my PhD program, and so I think like a lot of people. You have 3 paths ahead of you when you finish a PhD. You may think you want to become a professor and kind of go and do some great science and so on. Go join a large company or start a company. And for me, I took a sort of Pascalian sort of wager where I said, let me become a CEO. Let me start this company. Let me take a swing. I can take bigger risks. I'm still young. And even if it fails, I can still join a large company, and at least I'll have CEO in my resume. So, and probably get a better position. And so, I think, if there was an exit, it was in sort of a plan B or an exit plan in mind in case things didn't work out. But I always was going for essentially the impact. The first company was about essentially transforming DNA sequencing, bringing the costs down using semiconductors. And then the second one was about transforming human health.
Yeah, absolutely. I mean, you mentioned blood, sweat, and tears. No pun intended on the blood. But for those that aren't familiar with Guardant Health, so they really paved the way and pioneered being able to do cancer detection using a blood sample, as opposed to the traditional method of taking a tissue sample, which is really invasive and inefficient for both the patient and the providers as well. And so you're building this company in the most competitive place on earth, here in Silicon Valley. You're a Stanford student. So how do you think about competition now? Because while you were the early pioneers, there are some other technologies on the market now that are using liquid biopsy for cancer detection and prevention. Tell me about that. Tell me about competition and whether it's something that you think about or how you think about it.
Yeah, I think it all the time, owning a soccer team, so and losing the first like 6 games or 7. But competition is what drives innovation in many ways. Like if you think about all the amazing stuff we're sort of the beneficiaries of with AI or the semiconductor field or software and so on, and even electric cars, and it's competition that often drives sort of excellence in terms of human productivity and human performance on and off the field, certainly in technology and in business and so on. And so I can tell you that we are a better company and we aim higher, I think, when there is competition. At the same time, you have to have a clear roadmap of where you're going. And so I think one of the challenges of being a trailblazer is that you kind of have to move twice as fast, and you have to have more of a vision in terms of where you're going, because you can move a lot faster if you're a fast follower. You don't have to spend as much money on R&D. You can save a lot of that R&D dollars for commercial acceleration. And so it's not easy being a trailblazer. So we're one of the first PhD students at Stanford to work from engineering and work with the biotech, work with the School of Medicine, and so on. And that was hard because we actually had to basically translate the language of biochemistry and physicians to electrical engineering and vice versa. So there's a lot of work in terms of just paving the paths that that we had to undergo. The same thing on the Guardant side in terms of sequencing, where in terms of liquid biopsy, it was a new concept. We were funded by a lot of tech VCs. So we had our Series A from Sequoia and Series B from Khosla and Series C from Lightspeed, who frankly hadn't done a lot of healthcare investing. And so, there wasn't this pattern matching that you're seeing with a lot of the AI companies and so on, understanding, okay, this is, the Uber of this, or this is, the Canva of something else, or the Zoom of this. And so, and you go a lot slower as a result. The same thing, like we have the first FDA approval for multiple tests. We had to educate the FDA for many years in terms of how do you even do method comparisons? How do you even do validation of this technology? And so that probably took us a year or two longer than our competitors who fast followed behind us. And so, it's not for the faint of heart sort of being a trailblazer in a new area. You have to really have a vision of not just where you're going tomorrow, but where you're going a few steps ahead.
Yeah, I hear that. I want to spend some more time talking about speed, the importance of speed. I've heard you describe it as like a linear versus exponential, and Moore's law being at play here. It does feel like things are moving faster than ever. For those that are in the industry and those that are outside of the industry watching with all of the developments of AI, do you feel like these past few years are different from the years before?
Yeah, so it's the fuel for a lot of what we're seeing innovation in, whether it's the healthcare side or the tech side, is data. And so healthcare is very data starved. I mean, I know a lot of people talk about using AI in healthcare and so on, and it's just starting to, I think, be something that is really exciting. But the big part of why we started this company, started Guardant, was really to move data acquisition and accelerate it by 100-fold or 1,000-fold. If you think about cycles of learning as an engineer or as a scientist. How fast you move is the feedback loop before asking a question and answering it. And so if you think about something like cancer, where the information is locked away in a tumor somewhere inside the body, and the genomics and the disease is changing under therapeutic pressure, it's evolving just like COVID, where it changes, over time. But if you're not accessing that information, you can't learn of why this drug didn't work and why this did and how this, the tumor is growing. And so the whole thesis was, if we could get this same information through blood, we could essentially speed up that feedback loop. And when you think about the tau or the feedback loop, it's in the exponent when you think about like how fast things accelerate. And so that was the thesis. We could not only access that information much faster, accelerate cycles of learning, but we could essentially produce a lot more information. Think about like your average physical. They measure your temperature, lipid panel, maybe blood pressure, a few other markers, probably less than 100 bytes of information. With every blood test we produce now, we produce probably 10 gigabytes of information. So we probably produce more than most people have in their entire medical record with one blood test. And so when you have that kind of explosion of information, then you can really start doing something in terms of AI and data analytics and so on. And that's what we're starting to see. Maybe one more point I'll make about the linear versus exponential. My dad is in the finance field, and so I was always told that compounding is one of the most important forces that you should appreciate in terms of compounding your money. But it's the same way in technology. When you think about compounding, and most people have a knowledge of Moore's law in terms of doubling every 18 months in terms of semiconductor performance. But Moore's law is really just a specific instance of something called Wright's law, where the more you do, the more the performance grows, the costs come down. And we had that belief in healthcare, essentially. We believed that if we could improve the performance of the blood test, improve from stage 4 detection to stage 3 to stage 2 to stage 1, that over time we would expand the market dramatically. If you think about it, there are 1 million late-stage patients in the US. There are 15 million cancer survivors, and there are 120 million individuals who are at average risk of cancer in terms of screening. And so our view was, as we improve the performance, we'd grow our market by 10x every single time. And so that was the original roadmap we had in 2012. And obviously the details have been different, but we've exactly executed on that roadmap. And that's what I mean by exponential thinking.
Yeah. You've done a great job, actually, with thinking about margins as well as you're building your business. The revenues have continued to grow post-IPO and costs go down. And this is something that, I meet with tons of entrepreneurs, especially in the biotech, life sciences space, that want to build great science. It's not very affordable to build great science necessarily. So that brings me to the other thing that I'm really excited to pick your brain about, because I'm thinking about it on a day-to-day basis. And we're kind of in this era right now of longevity. Longevity is hot. You see so many solutions flooding into the market, building in the space of longevity. And some of them are not necessarily built on that strong scientific foundation or that strong clinical foundation. So from my perspective, these are fads that are not necessarily going to survive the hype cycle if there's not that strong scientific backing. I think there are a few other challenges as well. I'd love to hear if you've got an optimistic take on this kind of longevity boom. I think the big company, if you all have heard of Function Health, became a multi-billion-dollar company in what felt like overnight, but they claim that they can test your whole genome for several different diseases, almost all diseases, and it's completely paid out of the pocket. It's not covered by insurance, but that's just one, and there are several others. So I want your take on this, kind of the pros and cons, and especially would love to hear an optimistic take on this longevity boom and how we can leverage it.
Yeah, so when we started the company, there was probably only about $90 million spent in the US on early detection of cancer and early detection of diseases. And now there are billions and billions of dollars being spent on early disease detection, longevity research, and so on. And so I think, for the most part, if you take a step back, it's great that there's a lot of sort of effort, there are dollars and so on being spent in terms of something that I think we all value is, how do we maximize our health span? How do we live healthier for longer? And so that work is happening, but obviously, just an eternal sort of quest for humanity has been for the fountain of youth, and as long as that exists, people will take advantage of it. So there's always, snake oil. The term snake oil actually started in the 1800s. I think there's a guy named Clark Stanley who would do these exhibitions of you take a rattlesnake and squeeze the venom out of them and claim that it had these magical properties. And unfortunately, a lot of people got sick from it, but as you'd imagine, from venom. And so, ever since then, and even thousands of years before that, people have had that sort of quest for living longer and living healthier and so on. And so I think that's unfortunately the downside of some of that excitement. And I think I try to look positively. The fact that companies like Function Health and other companies, for the first time, are essentially able to tap in to disposable income, disposable dollars from individuals who, let's face it, in most countries, including the U.S., we're not used to paying out of pocket for things that are related to healthcare. We have insurance plans, public reimbursement in other countries. And so the fact that the revenue is growing really rapidly of these companies, I think is an exciting force that I think if used the right way can be used for good. And I'll give you an example. I have a close relative who did a pre-nuva scan and one of these whole body MRIs, and they found something. There's for every story that's positive, obviously there's people who find a lot of false positives and so on, but they found a true positive that they wouldn't have found if they just relied on kind of standard sort of medical checkups and so on. So more information is definitely good. It has to be used in the right way, but it's going to lead to better outcomes for sure.
Yeah. The Pronovo is, I think it's about $2,500 out of pocket. You do a full body MRI scan and you go into a physical clinic. And so their goal is to, identify a tumor early on, determine whether it's cancerous early on, something that might not be caught in the traditional brick and mortar clinic of going to see your primary care physician. So absolutely. I've also heard successful stories of something that would have been missed otherwise. So let's see. I want to step outside of your world as an incredible entrepreneur, Guardant Health founder, and just ask you something about the education system. And this was meant to be a fun question, but I'm genuinely curious what you think. So I definitely, grew up wanting to be successful, and I thought the key to success was to do really well in school, to study hard, get into the best universities, graduate, and that was your key to success. Feels like the education system is changing rapidly, and it's not so cool to actually go to college or get advanced degrees anymore. Some of our best, most recognizable entrepreneurs in the industry are college dropouts, and they wear it as like a badge of honor. And I think also with coding, programming, just a few years ago, the advice was don't go to college, just do a boot camp. And now that's actually changed again, where you can actually just vibe code, use Replit or another platform to do that. So do you recommend being an academic, getting advanced degrees, going to college, or should you just drop out and be an entrepreneur?
I have a 16-year-old, so I don't know, I have to be careful how I answer this question. But I think it depends on what field you're in. So I think the example is a 19-year-old dropout in a software field. But you look at those individuals, they put their 10,000 hours of coding in from when they were 12 years old, and they had a lot of experience. I think you look at maybe the sort of most famous example, a company like Theranos, and another 19-year-old dropout, and it's just most people don't have 10,000 hours of microfluidics and blood testing by the time they're 19. It's just not something like people do in the garage, and so it just depends. I think depends what field you're in. You have to put in the work you have to have the knowledge, you have to be able to essentially have an impact beyond essentially what others in the field have. It's all competitive, right? Can you move the state of play? And one of the reasons I went into biology from engineering was that I realized that there are a lot of, much smarter people who are doing pure electrical engineering, circuit design, and so on. A lot of people from the Middle East and, Iran and so on, who are really, really good. And I was just like, I love biology, wanted to go into medicine. I think I could, do something interesting by combining these two things. And sometimes in the valleys between disciplines, you find opportunities. And so, yeah, I would just say it just depends. Like, can you actually move kind of the state of the art based on the knowledge base you have? And yeah, the academic stuff is, it's a status symbol in some ways. It's a, kind of a check on a piece of paper. But what matters is the knowledge base and so on. And do you have it, and can you move things along?
Yeah, absolutely. Different ways to get knowledge. The soccer club. What inspired this? You bought a soccer club. Is this a hobby? Was this a business decision? A little bit of both? And can we all watch the games? Like, what can we look forward to for the soccer club?
Yeah, of course. Anyone is invited to come to Sheffield if you want to go all the way to Sheffield. It's an hour and a half away, or an hour and 40 minutes away from London. It's the fourth largest city in England. It's 130-year-old soccer club. There's a lot of history there. I'm a very competitive person. Played a lot of sports growing up, and fortunately wasn't good enough for soccer, but I played more tennis. I think there's one answer I give, which I was really into Ted Lasso and was sad that there wasn't a season 4, and wanted to have my own season 4. And now apparently they're like, it's coming back, so I didn't have to buy this stupid club now. So, there's a lot of things. I think when you think about the sort of world of AI in terms of where we're going, and I got depressed the other day, just thinking about, let's say 30 years from now, and when ASI and AGI and some of these things finally happen, what does it mean to be like, an intelligent human? Like, sometimes we pride ourselves on, I figured this out, or I wrote this, or I solved this problem, or this strategy. And you can see inklings where, we're likely to be more sort of curators at an art gallery, where, I think intelligence is, sort of, developed by these machines. And, the symbiosis of how we live in that world, I think, will be very different. But I think some of the things that'll be constant, I think, will be human competition, things like sports and so on. I don't see that going anywhere. And I think just like, it's the ultimate expression, I think, of the human experience, the competition in Premier League soccer. And so that's part of the thesis of why, I was very drawn to that.
Full circle. We started the conversation talking about competition, and we end the conversation talking about competition. So I guess those are the closing remarks. Everyone go compete, get out there. And Helmy, it was really a pleasure.
That's good.
Thank you, everyone.
Thank you so much.